I think we'll just wait another moment for people to join in. Well, hello and welcome. My name is Sat Bir Khalsa, and I'm thrilled to be offering PowerPoint lecture entitled The Science and Research on Yoga for Trauma and PTSD. And this is through the Give Back Yoga University, a virtual campus for yoga professionals, healthcare workers, and academic researchers to share knowledge and exchange ideas. So the format will be that I'll give a lecture, PowerPoint lecture for about 30 to 35 minutes. And then I'll take questions from the Q&A box. So if you have questions during the lecture, please go into the Q&A box, put those up, and at the end of the lecture, I'll read those out and answer to the best of my ability. So I'm going to go ahead and share my screen to get things started. And just to give you some insight on who I am, I'm an assistant professor of medicine at Harvard Medical School. I'm also the director of yoga research for the Yoga Alliance and for the Kundalini Research Institute. I work closely with the International Association of Yoga Therapists as the editor-in-chief of their International Journal of Yoga Therapy. And then I also have been conducting research on yoga for a little over 20 years, and I have a number of collaborations with integrative medicine groups in the Boston area. So I'm going to go ahead and get started with this whole topic of trauma. And I think it's important to sort of put a little bit of a historical light on this, because the whole idea that trauma or post-traumatic stress disorder is really a disorder is relatively new in the field of modern medicine. In fact, it's the biggest sort of issue that came historically was the appearance of what we call shell shock in World War I. As you can see from the book on the left-hand side, this whole idea that soldiers were experiencing these strange symptoms during combat, and they were associated with a number of behaviors and symptoms. And it also came to light as well, pretty famously in World War II as well. And some of you may know historically that General Patton, in confronting a couple of soldiers who were experiencing post-traumatic stress disorder, actually slapped one of them, arguing that their behavior was essentially cowardice. And this is portrayed in the top right-hand photo here. This is George C. Scott, who played George Patton in the movie Patton. And of course, this made the media during World War II, and the military was sensitive to this whole idea by this time, and had him apologize to the soldier and to the army. Now, post-traumatic stress disorder, as I've said, has a number of discrete criteria, and there are now well-accepted criteria for what is determined to be post-traumatic stress disorder, the point at which trauma actually becomes a disorder that interferes with daytime, day-to-day activities. So first of all, it requires exposure to an event that involved or held the threat of death, violent, or serious injury. And so that is the first criterion, that someone has experienced such a traumatic event. But it can also occur by witnessing in person the traumatic event. So as a third party observer, or learning that someone else close to you experienced or was threatened by the traumatic event, or even by repeated exposure to graphic details of traumatic events, for example, first responders, and even therapists who deal with patients who have experienced trauma will experience so-called vicarious trauma. And this will be sufficient for a diagnosis of post-traumatic stress disorder. Another aspect is that there has to be an associated number of symptoms, that patients typically relive the experiences of the event through exposure to images or through memories. You have to have upsetting dreams. You may have upsetting dreams about the event. You may experience flashbacks as if you were experiencing the event. And this is one of the characteristics of trauma and PTSD, is that the event appears as though it's happening in present time. And then there's also ongoing or severe emotional distress or physical symptoms if something reminds you of the event. So these are all sort of characteristics that can be associated with PTSD. Other symptoms, and these have to be occurring for at least 1 month after the traumatic event. Patients will avoid situations or things that remind them of the event. They may not remember important parts of the traumatic event. Patients may view themselves and others in a negative way. There's maybe a loss of interest in activities and detachment from family and friends. Emotional numbness, irritability, or angry outbursts, so emotional dysregulation. Dangerous or self-destructive behavior, and this can actually be violent behavior. And then there's a sense of constant vigilance or danger, and easily startling. Troubles with sleep is very common, as well as cognitive impairment through trouble in concentration. And these symptoms may cause significant distress in life or interfere with the ability to go about normal daily tasks. So this really is a bona fide and accepted psychological, well, it's defined as a psychological condition. Now, PTSD has achieved a good deal of recognition in modern society. And just to show you some examples of this on the left-hand side, this is a cover of Newsweek magazine talking about a new treatment that's been claimed for PTSD. And there's actually been a stamp that's been made by the post office on the topic of PTSD, entitled Healing PTSD. There's actually a national center for PTSD, and this is housed at the US Department of Veteran Affairs. And this is a free access website, and it has a lot of information and resources. So this is a screenshot from that website, and it talks about the prevalence of PTSD. About 7 or 8 out of every 100 people have PTSD at some point in their lives. About 8 million adults have PTSD during a given year. So these are US statistics. This is only a small portion of those who have gone through a trauma. About 10 out of every 100 women, or 10%, develop PTSD sometime in their lives, compared with only about 4 out of every 100 men. So there's a lot of statistics and a lot of information on this website, and I provided the web link at the bottom left. Now, in terms of the medical approach, this is now also a field of active research. In fact, there's a Trauma Research Foundation. The founder is Bessel van der Kolk, one of the leaders in the field of PTSD research, who also happens to be a yoga practitioner and a proponent of yoga application for the treatment of PTSD. And Dr. van der Kolk holds an annual conference on trauma called the International Trauma Conference. Now, if you go to the National Center for PTSD site, you can see what treatments are typically applied in modern healthcare towards therapy for PTSD. And there are two types basically that are listed. One is psychotherapy, and the other one is medication. And all the characteristics are defined here. What I want to draw your attention to is, first of all, the psychotherapy, of course, is all cognitive approaches: cognitive processing therapy, eye movement desensitization and reprocessing, and prolonged exposure. And these are primarily cognitive mental practices. And you can see here, it's talking about thoughts, it's calling the trauma to mind, it's talking about the trauma. So there is discussion of the trauma involved, want to draw your attention to, and of course, the pills are a number of antidepressant type medications that are used. What I want to draw your attention to is the effectiveness here. So it's 53 out of 100 for the different types of psychotherapies, and only 42 out of 100 for the medications. So what you can see is that a substantial number of patients are likely, even though they've gone through one of these treatments, may not be effectively treated. So there is a need for always investigating additional and new therapies for the treatment of PTSD. And one of the new therapies in the field of psychology and psychotherapy as a whole is really the whole idea of mindfulness-based treatments, the application of mindfulness meditation and related practices. And what you can see is that this has undergone a number of research studies and evaluations. And this is a review paper published just a couple of years ago on mindfulness-based treatments for PTSD, a review of the treatment literature and the neurobiological evidence. This is a paper, this is from the same paper, and this is a figure which really looks at the hypothesized mechanisms by which mindfulness-based approaches will work. And a lot of these are really, again, working on these psychological manifestations. So shifting attention to the present moment, which is the practice of mindfulness, increased openness to experience, willingness to approach fearful stimuli, non-judgmental acceptance, attentional bias, remaining in the present moment, and connection awareness, and being aware of somatic sensations. And the empirical evidence is also listed here. And so there have been a number of studies looking at meditation, mindfulness-based treatments, and I show you one from a laboratory that's done a number of research studies in this area. This is the work of Jill Borman in San Diego, and what they've been using is a mantra meditation practice for the treatment of post-traumatic stress disorder. So in this randomized controlled trial, you can see that the improvement, the reduction in symptoms on some of the measures of PTSD in the mantra intervention show substantial reduction in the symptoms and the scores compared to a control evaluation. A number of other measures of anger expression, quality of life, spiritual well-being, and mindful awareness are also improved using a mantra meditation practice as compared to the control condition, which has very little influence. Now, one thing I want to highlight is that this whole idea of treating PTSD as strictly a psychological condition and treating it largely with cognitive approaches such as cognitive behavioral therapy or meditation, I think is missing some of the features of PTSD that are very important. And one of these is the large number of physical symptoms that are involved in trauma and post-traumatic stress disorder. And I'm highlighting these here: angry or violent outbursts. These are behavior changes, dangerous or self-destructive behavior, hyperarousal, constantly on guard or alert, and startle easily. So there's actually a nervous system response, and that of course is based in the body. People can experience panic attacks, shortness of breath, dizziness, sweating, nausea, and a racing heart. People can have trouble sleeping. And many PTSD patients experience a dissociation from the body, or and as a consequence, this is likely due to explain why so many PTSD patients have lowered physical activity. They engage in physical activity much less than normal subjects who are not impaired. And then there's a lot of individual physical symptoms: muscle tension, chronic pain, headaches, stomach pain, diarrhea, tightness or burning in the chest, muscle cramps, or low back pain. And then patients often experience higher rates of neurological, respiratory, musculoskeletal, and cardiovascular symptoms. So what you can see from this long list of physical symptoms, what we're really talking about is not just a mental disorder. We're talking about a mind-body disorder. And so it makes sense, if you're going to treat a mind-body disorder, to use not just cognitive and mind approaches, but also bodily approaches. And this whole idea of using mind-body approaches and incorporating the physical component has achieved some attention. And one of the strongest proponents of this has been Bessel van der Kolk. And in a review paper back in 2006, he argued that interoceptive body-oriented therapies can directly confront a core clinical issue in PTSD. The traumatized individuals are prone to experience the present with physical sensations and emotions associated with the past. If past experience is embodied in current physiological states and action tendencies, and the trauma is reenacted in breath, gestures, sensory perceptions, movement, emotion, and thought, therapy may be most effective if it facilitates self-awareness and self-regulation, particularly of both mental states as well as physical states. And in fact, there is actually evidence for exercise alone to be effective in PTSD. So this is a review paper published fairly recently. A narrative view of extant studies provides encouraging evidence that aerobic exercise interventions alone or as an adjunct to standard treatment may positively impact PTSD symptoms. So if you will, this is actually evidence that addressing the physical components of PTSD is therapeutic. So this brings us to the types of practices that we're talking about when we talk about yoga. And this is a program called iRest developed by Richard Miller, which is a yoga-based protocol, but really focuses to a large degree initially on the whole use of Shavasana, of the physical relaxation. And so this is one study that looked at a qualitative evaluation of iRest for 16 male combat veterans, showing some positive benefit. And this is another study from the International Journal of Yoga Therapy, showing iRest as a treatment for PTSD, showing fairly strong effect sizes. 0.66 is a moderate effect size for improvement. And you can see the scores improving on the PCL, which is the post-traumatic stress disorder checklist, dropping from 56 to 47. Now, the other thing, of course, in yoga practice is breath regulation. And breath regulation is known to have really strong impacts on both the autonomic and now we know on the central nervous system. And has actually been found to be fairly therapeutic alone for treating many physical and mental conditions. So this is a study that looked at what's called respiratory sinus arrhythmia biofeedback. Essentially what this is doing, this therapy, is slowing breath down. So this is essentially a slow breathing intervention. And what you can see here is that there are, compared to simple progressive muscle relaxation, that there is a drop in the scores of PTSD, on the severity of PTSD, simply using this breathing practice. So the whole idea of breath actually can be very important. So when we're talking about the physical activity and we're talking about breath, we can also be talking, of course, about yoga, which incorporates all of these. This is a study that looked at Sudarshan Kriya Yoga, which is primarily a breathing yoga practice. And this was done on a population traumatized in the tsunami in the Indian Ocean. And what you can see in this intervention is that the intervention group showed here, this post-test is like 1 week after the intervention. And so this largely breathing intervention had a very rapid decrease in the PTSD scores in as short as 1 week. So this is really a suggestion that the breath may play a very strong role in facilitating improvement in PTSD symptoms. So let's talk about yoga and talk about, how this is really fit for this. And this is a logic model that we use when we describe how yoga can work on different elements within the body and the mind. And when we're talking about yoga, my definition is really not just the postures, but also the pranayama, the breathing techniques, the deep relaxation, and importantly, the meditative component. It's largely through all of these components we're having effects on the physical body. And that's largely through things like flexibility, strength, coordination, balance, respiratory function, and self-efficacy. And through the mind-body connection, this is not just having an impact on the physical body, but also through that mind-body connection on our cognitive performance and our emotional regulation. All 4 of these components contribute to what we call self-regulation of internal state. And the things that we're regulating most importantly are stress and emotion. And with practice over time, that leads to resilience to stress and equanimity in the face of the ups and downs of strong emotions during everyday life. And that leads to an overall psychological self-efficacy. Now, we know from the meditative and mindfulness practices that these lead to an improvement in mind-body awareness. This has also been referred to, of course, as mindfulness, which is now becoming a very popular term through the engagement of the attention networks in the brain through the practice of mindfulness and meditation. We're improving our concentration, our cognition. And over time, this leads to what we call metacognition, the idea that we can have self-regulation over our internal thought processes. Over time, we then understand that we can react differently to our thoughts. In fact, we can even change our thought processes. And metacognition is very powerful. It's actually the key element within the most powerful form of psychotherapy today, which is cognitive behavioral therapy. This whole idea of thought regulation being very critical and important in the treatment of many, many mental health conditions. So yoga shares this whole idea of metacognition with cognitive behavioral therapy, if you will. The other thing that happens with yoga practices, it is a contemplative practice, and largely through the meditative component, we see experiences of this unitive state during meditative practices, experiences of transcendence, the flow state. And this can lead many people over time, and typically longer practice, into a transformation, a change in life meaning and purpose. And this can be very critical for people with PTSD because this trauma has really impacted their sense of life meaning and purpose and their goals in life. So yoga over a longer term can lead to these positive improvements in what we might call spirituality. So one thing you can see is that this is truly a mind-body intervention. We're making changes all the way from the gross levels of connective tissue and muscle to the deepest experiences that humans can have and everything in between. And we have pretty strong evidence, research evidence for the physical fitness. And over the past 2 decades, a lot of research really showing these changes and improvements in self-regulation and awareness. And we do have evidence, although it's less, in terms of the benefits on spirituality and goals in life and life meaning and purpose. So because of these broad spectrum changes over many different functions, we're seeing changes in global human functionality, from the gross level of physical and mental health and performance to the deeper levels of stress and emotion regulation, improvements in mind-body awareness and mindfulness, and the appearance of metacognition. And over time, ultimately, improvements in positive behavior, well-being, values, life purpose and meaning, and spirituality. And so if you evaluate this logic model from the perspective of the symptoms and the diagnosis we've talked about for trauma, there's a lot of matching here. We do have the respiratory function, we have the pranayama practices, the self-regulation of stress and emotion response, which are severely dysregulated in PTSD, and then this whole sense of deeper experiences. So there's a lot here that really makes sense and is a good match for post-traumatic stress disorder. So this has become a popular area, and you can just go onto Amazon and immediately find very quickly a lot of book titles that really refer to this whole idea of the application of yoga for PTSD and its relevance. And at the top left, I'm showing here the book actually by Bessel van der Kolk called The Body Keeps the Score, really talking about this whole idea of trauma being a mind-body disorder and how yoga has relevance to the treatment of trauma. And as a result of Bessel van der Kolk's work, a lot of yoga therapists and yoga teachers have put together a protocol referred to now as trauma-sensitive yoga. And so now there's a whole number of books on this whole idea of trauma-sensitive yoga for the treatment of PTSD. And the whole idea of trauma-sensitive yoga is an important construct because people with PTSD are patients. And you can't just send patients to a regular yoga class, just in the same way that you can't send patients in wheelchairs to a regular yoga class. Yoga teachers have to be able to teach to special populations with special practices. And that holds true for PTSD. The whole idea of trauma sensitivity is important. I'll give 2 examples of this. And one of these is the fact that people with trauma, you can't just touch them and manipulate them as you would in an ordinary yoga class to adjust posture, for example. You can't put your hands on someone with trauma because this can precipitate an event with respect to their trauma history. Another example is that in many trauma cases, people are very sensitive to their location within a room. So if the room has no windows or their back is to the door, they're feeling in an unsafe position. And this can be very disturbing for someone with PTSD. So there's a lot of constraints in terms of teaching patients yoga who have these limitations and these symptoms. So there is a body of evidence now for mind-body interventions for post-traumatic stress disorder, and you can see that from a number of review papers that have been published. This is by Barbara Niles, who's based at the Veterans Administration Center in Boston. It's conducted trials on mindfulness for PTSD, and you can take a look at this review paper. The full length is presented at the bottom. This is another review on mind-body therapy for military veterans, also published fairly recently. And this is a paper really sort of more in the narrative line, really talking about bridging body and mind considerations for trauma-informed yoga. So discussing some of the important key issues to be aware of with respect to yoga and treatment of PTSD. And then this is actually a systematic review and a quantitative synthesis. So there's a number of studies now that have been, and this is a popular area of research. That's why we're starting to see a number of these papers. So after screening and review, they reviewed 12 articles and showed that there was some positive benefit for yoga as an intervention for trauma and PTSD. This is another recent paper. This is Mindfulness and Yoga for Psychological Trauma, another systematic review and meta-analysis. And again, they looked at the literature, and they looked at 24 controlled studies. And this was a statistical analysis. So just to show you some of the individual studies that have been done, Bessel van der Kolk has conducted early trials. That paper in 2016 was the first trial. This was a follow-up trial funded by the National Center for Complementary response systems. The total sleep score was also statistically significantly improved, and sleep is one of the most common symptoms of people with trauma or PTSD, and daytime dysfunction was also shown to have a statistically significant improvement. We've conducted a trial in Boston using a Kripalu yoga intervention that was funded by the Kripalu Center for Yoga and Health. And this was primarily conducted in military veterans. This is also supported by a grant from the Department of Defense. And so this was a Kripalu trauma-sensitive yoga protocol. And what you can see is yoga instructor Jennifer Johnston with one of the participants in the trial. And these are the results of the single group trial that we started out with. What you can see is the CAP score. This is the clinician administered PTSD scale. You can see for all of the individuals, there's a sort of a general decline in terms of the total symptoms on this score. So this is the total score. These are the statistics. This was a statistically significant reduction by the end of the 12-week treatment. And in a number of the subscales, we also showed statistically significant reductions. So re-experiencing the trauma, avoidance symptoms, in other words, avoiding circumstances and situations, and then the hyperarousal, the startle type of activated stress response system. We also went on to do a randomized controlled trial with the same intervention in the same population. And again, we saw reductions in the CAP score, the primary outcome measure. There was no change in the control group. This was a waitlist control. They were just simply delayed treatment. So they weren't getting any additional treatment. In terms of re-experiencing, again, the yoga is in the black bar. You can see the reduction in re-experiencing, in avoidance, and then also in hyperarousal. This also shows the PCL scores, and this is another overall trauma-sensitive measure. And what you can see is the general decline by mid-treatment and post-treatment, and no change in the control condition in the white bars. We also looked at a number of other measures. This is the impact of event scale, which is another alternate measure of trauma. And what we saw again was that there was this general decline in the total scores on that scale, as well as the subscales of intrusion, avoidance, and hyperarousal. Now, this is another study that I was involved with. This was a clinical trial in the general population conducted at the University of Toronto in Canada. And one of the things you can see here is some of the symptoms decreasing. This is the positive and negative affect schedule, measuring positive and negative mood states overall. And what you can see is improvements in their scores in the yoga group. In positive mood states, improving, and negative mood decreasing in the yoga group, which was in the black bars. This was a randomized controlled trial. We also saw reductions in measures of anxiety and also measures in insomnia, reduction in insomnia in the intervention group. And then, of course, on the PTSD checklist, which was our primary outcome, you can see the reductions in PTSD scores, no change in the control group. And then we also measured stress measures. So one of them was resilience to stress. And what we can see is an improvement by mid-treatment, which is maintained and maybe even enhanced slightly at the end of the treatment. Reduction in perceived stress in two measures, on the perceived stress scale and on the depression anxiety stress scale stress measure. And then finally, this is a study that was conducted in New Mexico, and this was a combination study. This was combining Kundalini Yoga together with cognitive behavioral therapy as a treatment for PTSD patients. And what you can see here is the PTSD checklist score before the treatment to the end of the treatment, and then the long-term follow-up showing maintenance of those gains, those improvements that the patients had over time. Now, I want to spend the last few slides just sort of to make it a little bit easier to understand, to share some of the narratives that we have from the participants in these trials. So this is the participant we had in our study with Kripalu Yoga. And this was from an interview that was conducted much later after the trial was over. He said, "I thought this was going to be nothing. I was going in for the money because it was a paid thing, but it was something beautiful. It was very useful. It was beautiful. I loved it. I felt full of energy and didn't feel stressed out. I felt very motivated, not right from the get-go, but after the first good week, I was really into it. My blood was flowing, my heart rate was better. I was doing it at home. It brought down my stress level a lot. I was more focused and more understanding. My temper came down a lot. I got flexible. I lost weight. My belly went down. I lost 10 pounds. So not only are we seeing some of the key sort of mental symptoms, emotional symptoms, we're also seeing the physical components improving as well. And then in our trial in Toronto, we actually conducted interviews with the subjects, and I've grouped these into the 4 categories that we talked about in terms of that yoga model in describing the model of how yoga works. So on the physical level and fitness, one patient participant said, "In the past, I was consumed by emotions. With yoga, I could breathe and link my body and mind. I could feel my legs shaking at times, my arms aching. For the first time, I could sense my breath. I noticed that with this yoga, overall, I felt better afterwards, everywhere in me, my mind and body." So this really emphasizes this whole physical component of yoga's benefit for PTSD. In terms of self-regulation, I would say my biggest benefit has been that I am more emotionally balanced. Often after class, I would feel really strong and balanced and really, really alert, but like deep calm. I would be able to return to that feeling the days I wasn't in class. So this is the idea of being able to self-regulate the stress and emotion response systems. In terms of mind-body awareness, one participant said, "I would be more aware and could then think more clearly how best to respond. When I would do that, I'd feel really peaceful after and just be able to work with my emotions and experiences in a healthier way." And then finally, spirituality. And of course, it takes longer for these kinds of changes, but we did have some quotes. So from one subject, "With yoga, I had a connection of mind, body, and spirit. During the practice, and when you become aware of those 3 things, or be aware of them, it seems like things are more possible. I had more peace, the idea of finding increased peace of mind. I mean, what could be richer than a sense of, a spirit, my spiritual self?" And then finally, this is another quote from one of the subjects in the study. And it really highlights this whole idea of conventional therapy and its limitations. "Psychotherapy is very emotionally taxing because you have to rehash and bring it up again, the trauma. I stopped going to a psychotherapist because I did not want to talk about things anymore. And that's what I liked about this, because I did not have to talk about those things, because that can get exhausting and it re-traumatizes. In this, you didn't have to rehash the story. So the beauty of these mind-body practices is that there's no dialogue about this, no narrative about the trauma that's necessary. You do the breathing, you do the postures, you do the relaxation, you do the meditative component, and somehow, by a miracle, the symptoms start to go away. So that's the beauty of these therapies, these mind-body therapies, and that you don't have to go into the narrative of the trauma itself. So I acknowledge the Kripalu Center for Yoga and Health for their support in that trial. I also work closely with the International Association of Yoga Therapists. And of course, yoga therapists are trained. Those that work with trauma are trained in the whole idea of trauma-sensitive yoga. So if you're talking about a patient, the best type of person to have your yoga implemented is someone who is trained in that area, who understands the limitations of the patient population. I'm also funded by the Kundalini Research Institute, which supports the style of yoga I conduct, and that was the style of yoga that we used in the study that was done both in Toronto and in the trial in New Mexico that combined yoga with cognitive behavioral therapy. And then finally, I'm also the research director for the Yoga Alliance. And on our Yoga Alliance page, you can actually find the research. We have a number of research videos and webinars. There's one on trauma, so you can go to that website, and it's similar to the presentation I just gave today. And we also have citations on the website. So people can go to the citations and actually see the research, either read the abstract if it's if the full paper is not available. And in many cases, the full text of the paper or the review paper is available. So thanks for your attention. And I'm going to go ahead and stop the share and take a look at any questions that we might have following the talk. I don't see any questions in either the chat box or the Q&A. So if you do have one, I can wait a moment or so if you want to go ahead and put something into the chat box, and I'm happy to answer as necessary. This is really an exciting area because there's been a lot of energy in the whole application of yoga for PTSD. And I think it's starting through these studies to achieve some recognition in the field. Another thing I'll mention that's topical is this whole idea of the pandemic. And of course, the pandemic has been associated with a good deal of stress. And the other thing that's been happening, of course, is that there's been a huge burden on healthcare providers during the pandemic. And in some cases, and if you saw some of the stories that were coming out of California and Texas, for example, on the high volume of COVID patients, and many of them dying, becoming very, very traumatic for the healthcare providers. And so this has been something that that we've also been able to address with yoga, this whole idea of burnout, which is sort of an increased version of chronic stress. And burnout, of course, can lead to, in intense circumstances, to the actual experience of trauma or PTSD. So over the course of the pandemic, there have been a number of studies that have been showing that that yoga has a benefit for the frontline providers, those that are dealing with the stress of this circumstance. So we do have one question in the Q&A box. And the question is, will your talk be available after today's live talk? If so, how and where? Yes, the Give Back Yoga University site will have this set up, and you can access the recording and come back to it. And then, of course, there's also the recording of another talk I gave on trauma similar to this one, which is free access on the Yoga Alliance site. Another question is, have you come across a specific variant of PTSD caused by incarceration, post-incarceration syndrome? And if so, is anyone applying a specific practice to this population once they are released from custody? That's a great question, but I don't have an answer for it. I'm not aware of that particular form of PTSD. However, one thing I can say is that there is a good deal of research that's been done on yoga in the prison system. And this has been done not only on prisoners, on incarcerated individuals, but also in post-incarceration. And the beauty of the results are that it actually, in some instances, has been shown to reduce the reincarceration rate, but also to improve the capabilities of the incarcerated individual to reintegrate back into modern society, because they're now more capable of coping with their emotions and more capable of coping with their behavior and not allowing their behavior to go into criminal aspects. So it has been used successfully in prisons, but I'm not aware that there's been any trauma symptoms recorded yet, but that would be a great idea for a number of yoga researchers who are actually actively studying yoga in prison populations. And I'm pretty sure that the prevalence of trauma in the prison population is much higher than in the normal population. Another question is, what are your thoughts around accessibility of trauma-sensitive yoga classes for people with PTSD, as well as yoga as a covered service by insurance if utilized for mental health ailments? Well, that's a big question, and the answer is that it's difficult to find someone who's trained in trauma-sensitive yoga. But I mean, the International Association of Yoga Therapists does have a resource where you can look up yoga therapists who might be trained in this area. So it's really not that common to find that. I mean, if you happen to be in the Boston area, there's there is a Bessel van der Kolk Center who which applies these therapies, but I think they're far and few between. So this really is a problem at this point in time. It's a relatively new therapy, and there's not a lot of yoga instructors trained in trauma-sensitive yoga yet. However, if you do an intensive enough search in the internet and you live in a large population area, there is a chance you might find a yoga teacher or therapist who has undergone trauma-sensitive yoga training. There are places and schools of yoga that actually offer this training in trauma-sensitive yoga. In terms of mental health, in terms of insurance coverage, this applies to all of yoga for all conditions. Really, we're not there yet. We don't have reimbursement by healthcare providers or insurance companies for yoga therapies, virtually for many different conditions. So that's a problem in the field as a whole. Another question here is, what is the best way to introduce meditation to beginners? Well, I think it's best to have someone one-on-one. I mean, and this can actually be done online. Certainly it's been done on the pandemic. It's important to have someone sort of instructing you at the beginning in order to understand the whole idea of mind wandering. This is one of the biggest aspects of meditation practice. Many people are under this misapprehension that the meditators go into a trance and then come out an hour later and they didn't have one thought during the entire time. And this, of course, is not real. Everyone who meditates has intrusions of mind wandering. And the whole idea with meditation practice and training is to understand that and appreciate that, and then appreciate the benefits and the experience of when you come into that stillness, when you're able to focus your attention either on the flow of thought or the flow of sensation in mindfulness practice, or in the focus on so-called concentrated meditation on a mantra or on a candle or on a word or phrase or on some single point. So it is important to have someone who has trained people in meditation practices. Now, having said that, there's a big need for meditation practices. There's now a lot of apps. And so there are some studies being done on the usefulness of these apps. And that may well be another avenue for people who cannot access someone who is trained in instructing meditation. So I think that's it. And I think we're pretty much up to time. So thank you for all your questions. Thank you for joining me today for the Science and Research on Yoga for Trauma and PTSD on the Give Back Yoga University. You can learn more about my work and find a schedule of my upcoming webinars at yogaalliance.org, and find more Give Back Yoga University talks, classes, and workshops at gby.university/schedule. That's gby.university/schedule. Remember, all the funds raised through Give Back Yoga University support not-for-profit yoga projects in prisons, hospitals, and community care centers. So your financial support is going towards a great cause. Thanks again for your attendance and your participation. Take care.